Hi everyone, welcome back to our channel. Thank you for following our video series. Two of that you've seen our video on diabetes, type 1 diabetes, type 2 diabetes. So today we want to talk about gestational diabetes. Thank you for following us, and we also do hope that you subscribe to our channel. Today, like I said, we want to talk about gestational diabetes, which is one of the 6 classifications of diabetes according to World Health Organization. Gestational diabetes mellitus resembles type 2 diabetes mellitus in some regards. This is as a result of relatively inadequate insulin level and low level of responsiveness. And the gestational diabetes mellitus is the diabetes mellitus that occur in pregnant women. Feature of gestational diabetes mellitus is that it is mostly diagnosed in the second or third trimester when there is high or increased level of insulin antagonist. When there is increase in the level of insulin antagonist hormone. Comparing gestational diabetes mellitus to the 2 previous types that we have discussed, in type 1, the insulin level is low or absent. In type 2, the insulin level may be low, present, or more than normal. But the main problem is that the receptor is defective and it cannot respond to insulin. But in the case of gestational diabetes mellitus, the insulin level is low. Also, the receptor is unresponsive, just like a case of type 2 diabetes mellitus. So the frequency of gestational diabetes mellitus is that it occurs in about 2 to 10% of pregnant women. So the basic factor responsible for gestational diabetes is pregnancy. So it only occurs when there is pregnancy, and like I just mentioned, it occurs in 2 to 10% of pregnant individuals. Complication of gestational diabetes mellitus is that about 10% of women that has gestational diabetes develop other form of diabetes, which is usually the type 2 diabetes mellitus. Apart from this, it also causes damage to the health of the mother and fetus. So basically in the baby, the effect of gestational diabetes can cause congenital heart disease or central nervous system deformation. It may also cause bone and muscle malformation. It can also cause macrosomia, which is increased birth weight, and it can also cause infant respiratory distress syndrome. This is by decreasing the production of surfactant by the increased concentration of insulin. It can also cause increased blood bilirubin level, and it can also cause perinatal death.